Jesus. Okay, so we just want to acknowledge God in our midst. Without him, we can do nothing. So let's bow down our heads and let's have a word of prayer. Father, thank you for your word in Isaiah that says that your ways are not our ways, neither your thoughts are thoughts. Your word says that as far as the heaven is above the earth, so are your mercies towards us. This morning we ask for your mercy. We ask for your guidance. Holy Spirit, we ask for your presence, that you steer whatever we're going to do here. When we finish, we'll give you all the praise and we'll give you all the glory. In Jesus' mighty name, and all shall say amen. Amen. Beautiful.
Thank you, Reverend, for this powerful prayer. We will want to invite our dean. But I believe the sandwich students, you heard. Or by now you are aware. Okay, if you are not aware, you'll be aware soon. I want to take this opportunity to invite our dean in the person of Professor Peter Adatara.
Good morning. Good morning. Okay, thank you, school officer. I initially do not like to be the first to speak, but today permit me to be the first to welcome you. I'm told the Vice Chancellor is on her way. I'm told the Vice Chancellor is on her way. Director of Public Affairs, Dean of International Programs, faculty, and staff, our distinguished students, ladies and gentlemen. It is an honor and a privilege to stand before you this morning as the Dean of School of Nursing and Midwifery to welcome you to this important, very important function, the SONAM UHAS Vocational Training Day. I know there are a lot of expectations as the students sit quietly. And within your minds, you may be asking yourself, why do we organize this day? But in order not to waste your time, with doing this to recognize the importance of vocational training in UHAS, it is one of our the major areas that UHAS from the beginning has introduced to ensure that students do not only acquire theoretical knowledge, but as well to equip you with the practical knowledge and skills. Over the years, we are told other schools, they've been able to organize it successfully. But today happened to be our term, the School of Nursing and Midwifery. It is my hope that this is not the beginning. This will continue. And we are hoping that as we gather here today, we will learn from whatever we are going to say today. And this will take us a long way to bring out the skills, the attitude that are needed to make you the professionals that we want you to be. once again, I welcome you to this SONAM UHAS Vocational Training Day. God bless you.
Thank you very much, Dean, for the welcome address. Per the program, we'll have our Vice Chancellor giving us some remarks. However, she's here to join us, so we will continue with the program. As and when she comes in, we'll do that. The school has a coordinator responsible for sandwich program. So I have the honor to introduce to you the coordinator for the program in the person of Dr. Anthony Cook.
Good morning to you all. And you are all welcome to this year's Vocational Training Day. They normally say that when the smaller ones will have to speak before the bigger ones will come in. Anyway, but it was appropriate that our dean had to welcome you first and then assure you of what we are coming to do this morning. For Sandwich, this is the first time we are having this forum. And I know Dean will not remember, but this is not the first time we are having the forum. We are having it for the first time for Sandwich students. We used to call it Post-Vocational Training Forum, otherwise known as the Vocational Training Day. It is the day that we use to share our experiences when anytime we go to the field. You know, when you go to the field for your clinical attachment, we follow you there and interact with you. We pick your concerns, we interact with your preceptors, and then at the end, we assess ourselves. We assess you, and then you also assess your preceptors. So today is the day that we gather to share such experiences. There are a lot that people learn when they go to the field for their clinical attachment. So today we'll get the opportunity to share our experiences with faculty and then with our colleagues. Now, what I want to put across is that, see, this is not just a forum for fun. It is very critical for us as Sandwich students, especially those of us who will be writing the professional exams. You have a lot to learn from fora like this, so that you will know how to prepare yourself going forward when you are preparing towards your licensing exams. For the vocational training, I must say that for students of SONAM, whether regular or Sandwich, it is very important for us. It is not just a forum where we go for any clinical attachment, but it affords us the opportunity to be able to acquire all our clinical hours, the hours that we need to gather before we write our professional exams. So immediately you leave here, you will go for an attachment. And you will agree with me that we are so serious about the attachment that any person who doesn't go for vocational training, sometimes you find yourself wanting, and then we even go ahead to let them repeat the vocational training. Why? Because apart from the fact that you have to acquire clinical skills, you also need those skills to be able to qualify you to write your professional exams. So for SONAM, vocational training is not only, yes, even though it's the university's flagship program, for us, it is very important for us so far as our clinical training is concerned. So a day like this is very important, and I think we will share with you what your expectations, how we would expect you to behave, what you should do when you are on the field for your clinical attachment. And then you will in turn share with us your experiences. Anytime you go for the vocational training, the experiences you also gather. Now, the importance of these fora is to make sure that we improve on the vocational training program so that going forward, we'll make it more effective and better for all of us. I use the opportunity to thank you and then ask that we make it a very serious event from now onwards. And we embrace it as something that SONAM will have to take seriously. Thank you, and may God bless us all. Thank you.
Thank you, Dr. Cook. I told you you're not going to spend my time. I thought it would be teases. Thank you. Let me take this opportunity to introduce to you some of our directors and faculty around. Let me start with Director of International Programs. We have in our midst the Dean of International Programs in the person of Professor Elvis Takan. So, I've spoken to you already, but I'm following some protocol. Dean of School of Nursing and Midwifery, Professor Adatara. Your own coordinator, Dr. Cook. We have Dr. Afaya Agani. I believe most of you don't know him. When we were admitted, he was doing his PhD in the land somewhere. He's back. You properly in the classroom. Anyway, we have Director of Director of Public Affairs in the person of Mrs. Maria Jura. Thank you. As and when we get other faculties, we'll introduce them to you. Thank you for your listening ears. The program continues. The HODs are supposed to give you short speeches here and there regarding the departments. But like you know, number of them went to main campus early this morning to teach you. So as and when they join us, we will talk about that. So I'll continue with the program by inviting Madam Florence to come up the podium. Madam Florence is my colleague and will be taking charge mostly on sandwich matters and access course. So very soon when you throw the issues to me, I will refer you that go to Madam. You understand? Okay.
Thank you, Aladdin. The next on the program is the HOD nursing to give us his speech. So let's call Dr. Afaya to stand in for him.
Please, at this juncture, Madam Florence is taking over the MCing. And Dr. Cook is in to speak to you on behalf of the Vocational Training Coordinator, University Vocational Training Coordinator, who is Mr. Edisu Basintali. He's caught up in a meeting somewhere, and Dr. Cook will do that on his behalf. Thank you very much.
Hello. Hello. Good morning once again. The university has a vocational training coordinator. Remember, it is not only SONAM that is involved in vocational training. The other schools also do vocational training. For instance, School of Health and School of Allied Health Sciences and School of Public Health. They also take part in vocational training. So the University Vocational Training Coordinator is responsible for coordinating all vocational training activities. Now, for those of you who are yet to go for the vocational training, what you should bear in mind is that we give you the opportunity to choose a facility where you will be comfortable. In fact, let me be quick to add that for now, you cannot choose a facility at any place at all. It should be within the region from where you come from, because there's a circular that is preventing you people from moving around to other places because of shortage of nurses. So I know when he comes, he will soon make this information available to you. So you start the vocational training by selecting a place that is that the university has an MOU with. Your training doesn't allow you to do your vocational training attachment at any facility at all. I'm well aware that some of you are operating at the CHIPS zones. Some of you are at health centers. And per the training that you are here for, it is not appropriate for you to leave your CHIPS zone, come back here and go back to your CHIPS zone again for practicals. At the end, somebody will ask, what will be the difference? We don't want that this thing that the value is the same. The value cannot be the same. So the value cannot be the same. You have to go back looking different. go back to your region well equipped with all the skills to be called a nurse manager, to be called a director somewhere, and all that. And that is why wherever you came from, at least if you are going back, you should go back differently. Those of you who always insist in attaching your going for attachment at your chiefs or health post where we don't admit patients, you will end up not improving your practical skills. And that is something that you should know. Apart from that, like I said, your seniors will be writing, they will be coming back for their practical exams. That's the licensing exams. Next week, on the 13th of November, they will be starting their practical exams. So where you attach yourself matters. If you want to be practically good, very skillful, then it means anywhere, when we give you guidance as to where you should go for attachment, you have to follow what we tell you. Otherwise, you will use the steady leave issue and keep attaching yourself at a health post where there are no admissions, and when you get to the final end of it, where you write your professional exams, then you find yourself wanting. That is not what we want. There are a number of you who will also go to the field, and then you don't apply yourself as we want you to be. As I speak, we have a number of you who are supposed to repeat their vocational training. You may dodge vocational training 1, you skip vocational training 2, but when you get to the final stage, you will not have vocational training results, so you can't graduate. So whether you are escaping with our knowledge or without our knowledge, you will be you'll be caught up in it when you get to final year. So those of you who are busy dodging the program, I will advise that you advise yourselves so that you don't get there with problems. Now, we have university accredited facilities. We have MOUs with some of them. So when we give you the opportunity, like Basintale, the university coordinator will give you, you take advantage and choose the facilities that we have MOUs with, and then those that we are comfortable and also sure that you will acquire all your clinical experiences. Don't wait till we are on the field, then you place a call. You say, oh, you want to change. Why do you want to change? Oh, I got to the facility only to realize that I can't meet my training needs. Some of you, the stories are true. Some too, they are not true. What I entreat, that I ask that you do is, whilst you are here, please take time and look at the facilities where you can get your practical skills. It is very important. You have ample time to choose. You write your final exams in December. So after December, you will be placed for vocational training. We don't want a situation where from now till December, after you are aware of all this information, you should still be changing. Level 400, you are good to go. You don't have a problem. 300, you have a final vocational training to take. 200, and then the rest of you, the 100 students, you also have your vocational training to take. Make a decision as at now. Don't let us get to December, and from now till December, you are still undecided. After we give you a template to place you, you write your name under a facility, only to turn around and say, oh, I don't want that facility. Some of you, your friends will invite you later. Oh, you can come and do it at my place. Then if you keep changing every second, some of you get to the field and realize that, no, it's not good. I want to change. It is not done. Thank you. Hello? Yes, so please, your placement is very important. For level 100 students, you are not expected to go to the polyclinics, health centers, and health posts. No, because we expect that you go through basic nursing skills. And we will want facilities that are well equipped to give you those practical training. So don't go to health posts, okay, polyclinics where some of them, they don't admit. They have only 3 wards. And when you go there, you won't be able to do a complete rotation. You won't get the comprehensive training that we want you to do. So please choose facilities based on your level of training. For level 300 and then, yes, for the 200 and 300, if you get the district hospitals or well-equipped hospitals that you can get your med-surg, you can get your midwifery specialty areas, we don't have a problem. And it should also be a facility that we have MOUs with. Some of you keep changing your facilities to the extent that you now choose new facilities that we don't even know about at the last minute. And that one, it becomes very difficult. Some of you will agree that you are not even monitored because of what you do, the last minute changes. Because if you choose a facility that we lose track, we don't even know where the facility is because it was changed at the last minute. It means we have to now find time, follow you around, and try to locate you, which sometimes it becomes very difficult. So your level of training and then the facilities that you choose is very important. This time round, we are very strict. And our monitoring system, we are going to monitor you through our preceptors, whom we are gradually, we have a database of all our preceptors. So whether we are coming physically to your facilities or not, we have a direct way of monitoring you now. So those of you who are going to play the lazy game, you are advised not to do so. Choosing the facilities is one thing. And then also knowing exactly what you are supposed to do. Now, let me take the opportunity to tell you that SONAM has developed a vocational training manual. The manual has all the objectives for vocational training 1, vocational training 2, and then vocational training 3. Depending on your level, you have your training objectives in that manual. And then it is for all the programs. You have that for nursing, midwifery, and then public health nursing. I will advise that you all get that manual. Very handy. Because we are going to tie your assessment to the, yes, you having the manual. The preceptors have a column that they will sign to signify that, to indicate that you have done vocational training 1, 2, and 3. So at the end, we will need to inspect your manuals. For those of you who are already escaping the 400, the 400, yes, you are free from buying it. But 400, I didn't say 300. I didn't say 400, you don't need, But the rest of the levels, if you are going for your vocational training, you have to go with the training manual. Okay? You have, hello? Good. So, if you have acquired it, it's a good thing. If you are yet to get it, please kindly get it immediately after this forum so that you will put it in your bag, send it along when you are going for vocational training. And please, it is not an excursion that we normally send you to. It is a course that has a course code, vocational training. That's a course code. That means that you are supposed to work for the grades that we award you. If you don't have any of the vocational training grades, then you are not qualified to graduate. We have current level 400, those who are writing their professional exams for vocational training. I know you think it's not possible, but it is. They got to 400 and then they had to do it twice. Some of them came here and attached themselves. Second vocation. If you have marks for any of the training, you would not be included in the grad. You may think that, oh, it's full work. I've gone there. I just went for 2 weeks, and no, complete the number of weeks. Attach yourself at the various units. Some of you, it's not the practical. So you have to consciously make sure you go through what I'm asking you to do. That's why I'm saying. So if you go back after December, you have a longer period to make sure you that you properly. At the long run, your seniors are here. Some of them are at the ward. If you do it properly and it comes to your professional examination, you see that you will be miles ahead. You will just need just small revision, and you go in for the exams, and then the 100% is yours. Otherwise, you will now come and be shivering. You'll be asking, oh, I'm not familiar with this procedure. How would you become familiar with the procedures if you still go back to the CHIPS center or the zone where you were, where they don't admit patients? You can't. So at the vocational training unit, he has his contacts. We have a database of all the preceptors. And then we also require that anytime you go for vocational training, the unit would send you assessment forms. This post-vocational training forum is not done this way alone. You remember that we give you Google Forms, and we ask that you will answer some questions regarding your experience. That is one way of doing it. Sometimes we realize that if we send the forms to you, the response rate is very low, especially sandwich students. You don't, if it is not lecture slides for you to write IA, you hardly open your phones to answer anything. These simple questions. Last year, I remember I kept sending the same thing to your reps. When they distribute it, then we would monitor the response rate at the end of a week. And I realized that whole sandwich class, only 10, 20, 30. Meanwhile, you are more than that. And you can't tell me that the Google link is not shared. It is shared on your platforms. Now, if you don't tell us what your experiences are, if you are the field, how do we get to improve this program and make it more relaxed and comfortable for you? We send surveys, you don't respond. And yet you come back and then you are very pregnant with a lot of ideas. Oh, we should have come to do this. The next time, make sure you do this. But the forms gives you the opportunity to say what you want to say. Now, you also have the opportunity to assess your preceptors. We don't send you for vocational training and say, you go. Whether you get a very good experience or not, it's okay. Next time, go back. We don't do that. We try to assess those preceptors that we send you to, because it is their responsibility to make sure they give you the training that we want you to get. Now, some of the preceptors are proactive. They prepare you, take you through care plans. You do post every day. You meet, and then you share ideas with them. They're able to teach you very well. Other places, it's not like that. So when we give you the opportunity to do an assessment, tell us those facilities where you have proper coaching and training, and those areas that you don't have the proper training. You don't respond. Some of you don't say anything. You are waiting for us to send you back to the same facility. And if we don't get to know which facilities are well equipped and prepared to train our students practically, we are sitting here. If you don't say it, we will keep sending students there, and they'll be getting the bad experience. So I'll plead with you that anytime you have those Google Forms from the university vocational training coordinator, respond to him. Sometimes he share the links with all of us, and then we keep sharing. I share because I have all the class reps' contacts. I share with you. Sometimes when you share, you put the link there, then they put shitter with the price below the link. If I share the link, expecting that maybe by weekend they will send some things across. No, they are not interested. You are not interested in the link. Google survey. So please, going forward, you need to help us so that we can help you. I have said a lot of things. Maybe after the last, maybe you will be given the opportunity to ask questions. So I'll be waiting for your questions so that we can address them effectively for you. Thank you very much. And then I wish all of us a wonderful VT day.
Thank you very much, Dr. Cook. Please, another round of applause for him. It's time for us to call in Dr. Bella Johnson to give us a short note. That's our clinical coordinator.
Good morning. Dr. Cook has said all, so I will only add one or two things to it. I'm sure you all know the importance of this practicum that you are supposed to go to sharpen your skills. Aside acquiring those skills for your profession, to become an effective nurse, those of you writing the licentials are supposed to attain a maximum or a minimum hours of practical contact. Minimum 1,500 minimum contact hours before you be registered for the licentials. It seems we have not overstressed on it. This time we are going to be very strict. So, aside as I the skills are equipping you to work as an effective and efficient nurse, midwife, or public health nurse. You need to. So don't joke with the practicum or the vocational training that you are placed to do. When you look at our mission, we are supposed to train professional nurses with proper skills. So I will urge you, put in your maximum effort. Then also the practical exams. It also has a portion. You have to write a certain number of practical exams before you could be registered for licensure. As I'm repeating again, this time we are going to be very strict. If you don't attain those hours, then you'll be referred in the vocational training practicals. You do it before you come and register for licensure. So please make the conscious efforts to take the vocational training or practical seriously. Dr. Cook has advised you how you will attain those hours, because you are not on list and you have to work in your facility. You have to make other arrangements to make sure that the objectives that you are given, you attain it. You can see with me that level 100 objectives are different, level 200 objectives, every year's objectives are different. You need to acquire one or meet those objectives before you move on to another. So when you go to the facilities, the preceptor will not come and force you. It's not everybody, like he said, will not come and force you to do A, B, C, D. You know your objectives, what you are supposed to acquire before coming. So make sure that those objectives are met before you move on to the next level. Now, this UK thing is also around now. And there was the recommendation we will write to confirm the hours that you have worked. So take note. I tell you that some people are gone there, but they have brought them back. They were not able to be initiated into the system because their skills were very poor. They couldn't even go to the nursing homes. So now that everybody is UK, US, make sure you get the competent skills. So that will not go and the US student, you are a US student. Those entered badge, they have already made a name there. And the US students are selling. So make sure you don't spoil our record. Take your vocational training serious. Thank you.
Thank you, Dr. Bella. Please, we call in our director of PA, who is in our presence, to just give a short word. So with a hand of applause, let's welcome her.
Thank you. It's so nice to see such a wonderful turnout. All of you have done well for making the time to come. Hopefully, I think that we can assume that this is a sign that you understand the importance of vocational training as part of what is required of you as a UHAS student. So I want to just take this opportunity to congratulate those of you who have gone through the discipline of applying yourselves and going through the motions and fulfilling all righteousness. As I think that everybody has already made the point, and you should know by now that for coming to UHAS, particularly with language students who are already out in the field and coming to UHAS, it's because we have something that you need, that you don't already have, which will enable you to further your career. And we have determined that vocational training is one of the hallmarks of getting a UHAS degree. So for you to come here and then try to shortcut vocational training because you feel that, oh, as for me, but I'm already in the field working, I think that you're doing yourself a disservice. Because if you, in fact, had all that you needed to be able to further your career, as we say in multiple Ghanaian languages, sebi sebi, you wouldn't have needed to come to UHAS. Am I speaking to someone? Okay. So now that we've agreed that you need UHAS, which is why you have come here, the vocational training aspect is a very, very important component. This is one of the pillars on which we stand as a university, which differentiates us from other universities. And I guarantee you, when you finish going through our vocational training, which will then qualify you to get the UHAS degree, you will realize that it is true that you were in the field and you were working on the job, but certain elements that are required for you to even understand why you even do certain things that you do on the job, this is where we will impart it to further your understanding of the field in which you're operating. Besides, this is what will also qualify you carrying that UHAS degree and going wherever. You people are selling like hotcakes in other parts of the world. But guess what? It isn't just by showing your face and saying, oh, but I've been working in the field. You need that paper. And until you go through the vocational training and fully qualified as having done everything that UHAS requires for us to qualify you, you will not get that paper. Are you understanding me? And so please, stick with it, apply yourselves, take it as good medicine that you are taking on top of medicine you've already taken. And then when you're done, you can give yourself an ayeko. So it's good to see all of you, and congratulations to those who have managed to successfully complete the program. Thank you.
Thank you, Director. Please, let's give it to her again. We now invite our VT coordinator for SONAM, that's Reverend Atiogbe, to give us a short.
Okay. Good morning. Well, all protocols observed. I want to speak to us. I'm a man of few words. So I'm going to go straight to the point. Dr. Idrisu has said, Dr. Cook has said a lot all about VT. But I want to start from monitoring and supervision of VT. You see, you're already talking to each other. A lot of you, or majority of you, are not on steady leave. And that is where we have a lot of problems. Let me just give you two instances. I want to talk about Swedro Government Hospital and a Catholic hospital in Asimfosu. Where is that hospital? What's it called? St. Francis Xavier Francis Catholic Hospital. So let me start from there. The Central Region team that was coming for monitoring and supervision, what we do is that before we get to the facility, we have your telephone numbers. So we call you. So before we got to the facility, we've been calling these students. We kept calling them. They wouldn't mind us. Then we enter the hospital, straight to the nurse manager's office. I got there first. Then the other three faculty were coming. And then they said, Reverend, please come. The nurse manager was already coming to meet us. Reverend, please come. So I went out. They said, one of the ladies have called. What is it? He said, they don't have steady leave. The hospital is not aware that they are in school. And that if we go and tell them, then it means that no more salary for them. So we got there, we said, what are we going to do? Because they've seen us. Then we said, okay, we are just going to tell the nurse manager that we are on familiarization tour. Yeah. So that's exactly what we did. And then they gave us some water to drink. Yeah, so we familiarized ourselves with them, we chatted, and then we left. Number two, Swedro Government Hospital. It was a gentleman. We kept calling, he wasn't picking. We called, he wasn't picking. Wait till we are doing our job. Dr. Paul, we were doing our job. So we entered the hospital straight to the nurse manager's office. The nurse manager wasn't there, Dr. BBJ, but the assistant was there, who was also a DDNS. So well, how can we help you? So we have one of our students here who is doing VT. He said, who is the person? We mentioned the name. Then she took a phone and called the student. When we called the student, he didn't come. When the DDNS called, he came. Oh, Eradinya Kupon. No, we felt so bad. So what have we done? We didn't do it. We started begging. We said, so she'll hand it over to the boss. So I'm saying this to say that if you are not on steady leave, let Dr. Cook know. Let Dr. BBJ know. Let Prof know about it. We are human beings. I think that I've told all of you, I'm sure all of you, because all of you have done mental health nursing, that you are mentally healthy if you are able to master your environment. Oh, yes. And the level 200s, when I met you, I said, look, some of you don't have steady leave. What do? Maneuver. So all of us have maneuvered before. Oh, yes. Oh, yes. You have to maneuver. Dr. Ellen, have to maneuver. Ah. So please, this program that we've organized, it will earn you marks. If you are absent, you will not get that. When we gave the information that some people are not here. But nobody came to call you wherever you are that to school. We have our rules here. Once you come, you are. Is that not so? Oh, yes. But I also want to say that we are human beings. If you have a problem, come, we'll sort it out. And I'm sure a lot of you have come to Prof and your problems have been sorted out. Dr. Cook, we are human beings. Come and we'll help you. So please, if you are on steady leave and as an no, that relate. That is why you must your nurse managers very well. Oh, I'm telling you, they will release you one time. There are that their nurse managers, their HR managers have released them. Why? Because of relationship. Oh, I'm talking about good relationship. Oh, yeah. What I mean. It's important for you. Came here and I saw cool. It's very easy. Easier than practical is done elsewhere. Oh, yours is very easy. Very easy. So I should complain. So that's about monitoring and supervision. When we are coming, we'll call. Even when it is 7 o'clock, when it's 9 p.m. I remember Central Region when we were there, we went to Breman Esikuma. You know, we left somewhere, Mankesim, there around 7. We called them. We said, we are coming. They waited. I'm sure there's one Breman lady girl here. She's around somewhere. 9 p.m. They were there waiting for us. Congratulations to you, Breman Esikuma. You don't know what we go through when we come for monitoring and supervision. When we left Breman Esikuma, we told them we cannot go by the road we came because it's so dark and spooky. Yeah, we were 5 in the car, but we were afraid because it's night. They said we can go by a new road that is being constructed, a bypass, and we took that road. Then we got to the Asimfosu Kumasi Road. So instead of to go this way, we went this way, Kumasi Road. We got to a barrier somewhere. Then the policeman, I think this policeman is intelligent. He saw the car, said, UHAS. Oh, anyway, where are you going? We said, we are going to Cape Coast. He said, Radi, you are heading towards Kumasi. Yeah. Because we were tired. It was dark. That was around midnight. The driver was damn tired. So, Mr. Avo, and all of us were drivers in the car. So, Mr. Avo took over the vehicle, drove all the way to Cape Coast. We got to Cape Coast around 3 a.m. We got to the nurses, what do you call it? The nurses something. We slept for about 2 hours. By 5, we were up because we were going to go to Dunkwa on a thing. That's where we're going to start. Yeah. And unfortunately, we took the bush road. That is, I don't know what to call it. As we were going, the people said we should pray that it will not rain on the way. Because when it rains, you can't drive. The car will skid off. By the grace of God, we went to Dokonofin and we came back. So we go through a lot to come and monitor and supervise you. That is why you must take VT very important because you are dear to us. Oh yes, the truth. It's the absolute truth. Ayembisa. Yeah, it's the absolute truth. So I told you I won't speak a lot, but I have on my phone the way we score you, and I just want you to hear about it. This meeting that you have come here now, you will get some marks. And that's why we are taking attendance. Yeah, you get some marks. You will get some marks. When we come for monitoring and supervision, we give you marks. We are going to give you some care plan to do. That will give you some marks. And then the monitoring, the evaluation that we give you, that will only take 40 marks. Oh yes, that will only take 40 marks. So you see, all the meetings that we have, there are marks that we allot to you. So you must be present at all the meetings that we call you for. That we call you for. Is that okay? All right. Since I'm a man of few words, I want to hand the mic over back to Madam Florence, so that I think that we'll now start with the, please come and take the mic before I start. I take your work from you. Why don't you clap for Madam Florence?
Thank you very much, Reverend. Please, let's give it up for Reverend again. Please, we have some new people in our midst which I would like to introduce. One is the HOD for midwifery, Dr. Ellen Cruce. There's also the Assistant Registrar for Quality Assurance, Mr. Maoli Yogbo Agwe. Thank you. So it's time we call in the HOD for midwifery to give us her speech, Dr. Ellen Cruce.
Thank you very much, Madam Florence. Let me take this opportunity to welcome all our dear students back to school. It's always joy to have you back, because I keep saying that for the mature students, when you are in their class, you are not there only to teach. You are there to learn too, because they have a vast experience which they bring to bear on whatever the subject may be. Reverend has said a lot, and so the few that I want to add is this, that it will not be ideal if all that we do is about theory, theory, theory. It is important that whatever we learn, we try our hands to see how far we have advanced and where there are gaps, we are able to close them. I was talking to the health promotion class yesterday, and I was telling them that most of the classes or most of the courses or programs that are run here in UHAS are hands-on programs. But because the times are very short, especially for the sandwich class, that is why it's as though you do a lot of theory. For instance, for the health promotion like this, we are supposed to go to the communities, pick cases, and be able to intervene so that the things that we are learning in the classroom, we are able to see how we apply them firsthand, even before we are qualified and are turned out as nursing officers. But because of the shortness of the time that you have, and then the intensity of the lectures, some of the things are waived off, thinking that when you go for VTs, you'll be able to do the hands-on practice there, gone into planning our programs. Being a crash program or very short duration, it is our hope that when you go for the VTs, there and then you'll be able to, put into practice the new things that you are learning. Our prayer is that the way you were before you came, you had a vast knowledge, but the things that you are learning here should be able to impact the way you conduct yourselves and the practicals and the rest. So that is why the VT is there. So I will not talk much. I'm like Reverend, a woman of few words. So all that I want to say is that let's take VT very, very serious so that the things that we are learning, we implement them. And also when we are coming, just like the Reverend said, some are very smart. Before you bend the corner to their facilities, they will send people or signal you that you shouldn't see their authorities. So why don't you make that known to us before we set off? That is why we have coordinators. Dr. Cook is there, Madam Dr. Johnson is there, the HODs. Let us know your plight. Then we know how to plan it. Supposing Reverend was not smart enough to say they are coming for a familiarization tour. So if you have issues, don't keep it to yourself. Don't let us do the list, distribute you and all that before you come back to tell us. Let us know ahead of time. Information is important. It's good you let us know, yes. But the timing is also important so that whatever the issue may be, we'll be able to deliberate on it before the time comes. So I use this podium to welcome you back and to tell us that let's take today serious, and then whatever we are going to discuss here, let us implement them so that by the time we come out as special NOs, I say special NOs because you are already on the job. It's just a certificate we are waiting for. When we turn out, okay, our lifestyles, our conduct, everything about us will show that we have gone to school and we are back. Thank you so much. I wish us all a fruitful deliberation. Thank you.
Thank you, Dr. Ellen. Please, it's time for presentation. We are starting with midwifery level 400. And the leader is Anna Sklinogo and her team.
Good morning to the Dean of SONAM, to all school officers, all protocol duly observed, and hello to dear colleagues present. Hello in the sign language. Yeah, you get me. Yes, thank you very much. We thank God for how far He has brought us. We thank God for such a beautiful day. So, as they prepare to project our presentation, I am Anastasia Klinogo, as already mentioned, from midwifery sandwich level 400. So we are talking about a journey through our vocational training experiences as midwifery students of the University of Health and Allied Sciences. Personally, I know that we have a lot to share, but because of time and to give way for my other colleagues to also share their experiences, we are only going to give you a handful of the experiences we gathered from colleagues. And so I would want to wait so that he projects it and then we go through that. Thank you. Okay. So the outline of the presentation is the introduction, importance of clinical vocational training, practical experiences of some colleagues, impact on students, and then conclusion. Introduction. So basically, VT is a practical and skill-based training, as we all know, that is aimed at preparing and equipping students with the necessary competencies, knowledge, and hands-on skills or training required to provide safe and effective care to patients before the completion of our studies, and also to prepare us adequately for our NMC licensing exams. So basically, we go out there to have a hands-on feel so that it is not just about acquiring the certificate, but then it comes with the competencies, the skills, so that when you are in the ward or wherever you find yourself and they call you to perform an activity, it will not be like, she says she's a degree nurse, she says she's a degree midwife, meanwhile she cannot do anything. But we are given the opportunity to go and learn, to be able to impact positively on our clients and in the society. Importance of clinical vocational training. So the clinical vocational training is essential component of our education. It provides us with hands-on experience, as I've already mentioned, in preparing us for our future careers. Through clinical vocational training, we are able to apply the theoretical knowledge we learn in the classroom to real-life situations. This allowed us to develop practical skills and gain a deeper understanding of our field of study. So some of the experiences that our colleagues shared. During our clinical vocational training, one of our colleagues at Lekma Hospital in the Greater Accra region had a very interesting experience with the use of the condom tamponade procedure. Even though she was taught how this procedure can be used in the management of postpartum hemorrhage, she wouldn't have witnessed the procedure if not for her vocational training experience. She recalled how she was amazed at how just a normal condom, as we all know it to be, could stop bleeding in real life situation. She stated, with an aseptic precautionary measure in place, a sterile rubber catheter fitted with the condom was introduced to the client's uterus. So basically, when a client is having PPH, one of the measures that is done to help control hemorrhage is the use of the condom, and that is her experience at the ward. The condom was then inflated with about 250 to 450 mils of normal saline. The condom with the catheter was left in to control the bleeding for 24 hours. When I reported to work, that is from the colleague who shared this experience, the next day, the client's bleeding had ceased. You know, there are other interventions that we do in controlling the hemorrhage. I was amazed at how a midwife could easily and skillfully perform such a procedure to save the life of this woman. And then there was another experience shared, conducting delivery on a psychiatric patient. This was another student's experience during the vocational training where she witnessed the safe delivery of a mentally ill patient. She recounts how the midwives conducted the delivery without any sedation, despite the woman's confused and uncooperative state. You can imagine when they are in pain, the way some of these our clients react. And they wouldn't listen, even for, excuse me, in quotes, for those who call themselves the normal clients. When you are in labor pains, you won't hear anything. You can imagine when a person's ability is a bit compromised and you have to manage. But per VT, our staff or our colleague had a feel of how to manage, so that in case she meets such a client, she will know how to manage the person. And I experienced during psychiatric affiliation. Another also shared an experience she had at Pantan, Psychiatric Hospital Substance Abuse Ward. It was interesting to see people of very respectable class in society undergoing therapy in the ward. At the ward, she had the chance to see at first sight the drugs that were administered to help maintain the patients. She also had the opportunity to engage in their daily routine activities, such as morning devotions, the formation of words and quotes, playing games, and therapy sessions with their doctors. And I also remember during the psychiatric affiliation, I had to call Reverend. I was like, Reverend, everything you taught us, I am encountering them. It's like you meet patients with all sorts of behaviors that had been taught us. And so I thought, I felt like this is a good feel of whatever has been taught in the classrooms. And when you go back to your wards and you encounter some of these clients, you know how to manage them and how to handle them. Impact of vocational training on midwifery level, 400 students. The clinical vocational training program at our various health facilities had a significant impact on both the hospital and the students. One of the most notable outcomes is the increased level of exposure it provided the students. And then the hands-on experience gained by midwifery students throughout this program resulted in improved patient outcomes and overall satisfaction with the hospital services. You realize that even though we are going to learn, we also go in to add on, okay, to their numbers at the facilities. So we are learning and we are also supporting. At the end of the day, we achieve client or patient satisfaction. By providing midwifery students with the opportunity to gain practical experience in a real-world setting, the program has helped to prepare them for their future careers while also addressing a critical need in the community. Impacts or outcomes. It enhances on practical skills and improves on the confidence levels of students. Yes, because if you don't go for VT to really practice with your hands, it gets to a point where you graduate and then you are not able to do certain things. So when they call you to do this, always you want to do ward rounds, because you know that when it comes to passing catheter on a male, doing this or that, it becomes a difficult task for you. And so it has built on our confidence levels and skills. The monitoring and supervision aspect also boosts our morale and makes us feel very well belonged. I remember from my facility, my nurse manager once made a remark that, hey, as for UHAS, UHAS so far is the only university that comes on monitoring. And it makes you feel so proud of yourself. It's like, I've gone to the best university. A thumbs up to the leadership of UHAS. Limitations of VT. Most of us didn't have much hands-on practical during school lecture schedules. This made us unable to perform certain tasks given to us during the vocational training. So it means that when you go and they feel like you are doing midwifery, and so you could do anything, everything. But because we had short knowledge with the practical aspects over here, they call you and you are not able to. But then we ended up learning at the end of the day. Though we learn a lot during our vocational training, the duration is too long. Yes, because some of us don't have the steady leave, as Reverend was recounting. So it becomes difficult if you have to spend 2 months or 3 months without steady leave. Recommendations. We would appreciate it if hands-on practical sessions can be incorporated in academic calendar.
Who may have difficulties in an area of practice? Yes. Sometimes when you have a difficulty in practicing some of these things, the way some of the supervisors will judge you, sometimes you feel so bad. Yes. Hello? Yes. The way they will embarrass you, in fact, it's too bad, and it doesn't make you feel happy. It doesn't make you feel happy to continue even the rest of the VT. And as I said, when it's happening that way, you sometimes dodge most of the activities and the procedures because you don't want to embarrass yourself again. Okay. So one of the recommendations is that advanced nursing should be included in public health nursing sandwich curriculum. What we have realized is that advanced nursing contains most of the procedures of which we go and meet at the ward, which we are also not doing. So some basic advanced nursing procedures we don't know. And because you don't know, you go there and you find yourself wanting. And it's too bad. It's too bad. So courses should be taught in class before students set to do after semester practicals. Yes, I think it is better if you learn the theory before you go to a field to practice. At least by then you have already gotten some information and you can build on that. Something like the maternal.
Good morning, dear students, observed, and my fellow students. I'm in a person of Mary Ampedu presenting for nursing sandwich level 400. Please. Okay, thank you for giving me this opportunity to present to you some of our challenges and experiences we had during our VT clinical settings in level 200 and level 300 respectively. Okay, so for our challenges, when we presented our letters to various hospitals that we were supposed to start with the clinical, some of us, when you took it to the administration, they took the letters and told us to come the following week or a days before we were supposed to start. So supposing we were supposed to start on Monday, they took the letter and told us, okay, go, today we are busy, so come on Friday or the following week so that we will draw your schedules for you. And other facilities they told the students to present certain items which the amount that was involved was very, very high. Some were asked to buy a box of gloves, like 5 boxes of gloves and other things. And others were also asked to buy big tissues, the full pack. And since we all know the economic situations in the country, we were finding it difficult. And the hospitals too, you have to present it before your schedules will be drawn to you, before you can start your VT practicals. And also, some of the staffs on the ward were refusing to adhere to the objectives that were given to us. When we are going for the VT, you'll be given an objective for you to cover, but when you take it to the ward, the in-charges take it, and at the end of the day, what you are not supposed to do is what they will ask you to do. And when you try to complain that, oh, please, this is what the letter says I'm recommended to do, they tag you as maybe you are being rebellious towards them or something, but you have to go according to what the objective says, because that is what you were taught. I'm not saying that when you are given something different, you shouldn't do. You have to do it, but it has to be done under supervision so that when you are doing something wrong, the person you're in charge or your colleague or the staff there can correct you back on track. And other challenges too were, as you all know, and as my previous colleagues have said, some weren't having steady leaves. When you go and you get a lenient in charge or matron, she will tell you, okay, if you don't have a steady leave, bring your timetable from work so that I'll look on it and draw the schedules for you so that it won't coincide with your normal duties. Others too weren't lenient enough with some of us. So at the end of the day, your VT schedules ended up crashing with some of our work schedules, which made it very difficult for us to be presenting always on the wards and the wards accorded to us to work in. And our experiences. Some of our colleagues, when they went to the ward, me personally, when I was at the surgical ward and we had a case, the man had he was diagnosed as large inguinal left hernia. And the weight of the hernia was, I think, 7.8 kilograms with the width was 12 centimeters. So I asked the man, so how are you able to manage with your daily activities? When we examined him, he has sewn some special clothes like the one we used to wear the babies on the ward. He has sewn it and he has tied it around his neck so that it won't interfere with his movements and other things. So he had the intervention of some NGOs who wanted to pay for the surgery because he had it when he said he had it when he was 37 years. And it has been there. When they brought him, he was in his late 50s. So they took him to the theater. They did the surgery. Almost 70% of his abdominal organs were already in the sac. So when they did the surgery, they brought him back. He was fine. After 24 hours, he was not fine. He will call you, Antoinette, I'm having this, although he wasn't complaining about pains, but he said he wasn't feeling okay within his system. So they had to take him back to the theater and they opened it. So when they opened it, what they found was his immune system was attacking the organs that were pushed back into his abdomen because it has been down there for so long. So when they pushed it back, the immune system was attacking it because it has become a foreign body to his system. So they had to refer him. When they referred him, on his way going, he lost his life. So when the medical soup came, then we asked, because it was an issue of interest for everybody. So the medical students, the physicians, assistants, and everybody was interested in the case. So we asked him that, why is it that when they did it, he was fine, but later he wasn't fine? Then he said they shouldn't have pushed back all the organs on the same day. They should have waited. Maybe today they'll push the colon up, then they'll wait. Then when the system has recognized it, then they'll push another system. But they ended up pushing everything inside, and the system was fighting against what was normal. But because his wasn't there for a long time, they were fighting against it. So this was one of the major experiences I had. And I was very privileged to have a view of when the procedure was going on. We were standing there, they were doing everything, and that was my first time experiencing someone having those things. And another colleague just told me she had Steven Johnson syndrome on the ward. And that was the first time she was also experiencing those things. So with the VT practice, it's very, very good for us because we learn the conditions in the classrooms. But it's only when you go to the ward that we have the feel and the experience to see that, okay, so this is this and this is that. And during the psychiatric affiliation as Reverend taught us everything, and I must recommend him, he did a very, very, very good job with the teaching. Because when we went, whatever he taught us, it's like you are like free show. In the olden days, free show, because whatever he said and how he demonstrated it to us in the classroom, when we went on the ward, it was there vividly for you to see that, yes, in fact, this is this and this is that. So at the end of the day, even if you've forgotten the book aspect of it, you can visualize what you saw on the ward. And when you met it somewhere, you'll be able to say that, oh, okay, this thing I've met it, so this and this is what we did to make it, to make the person okay. And when I went to the Accra Psychiatric Hospital too, I was looking forward to experience the ECT, that is electroconvulsive therapy. I was looking forward to see it, but when we went, theirs was faulty, so we couldn't experience that one. And I was really, really disappointed because that was the main reason why I went there, so that I would see how the whole thing is done. Because when Reverend was teaching us, how he demonstrated this to us, it was really, really, I was looking forward to see how it was done. But since it was faulty, there was nothing we could do about it. And the staffs on the ward too, they were really kind to us. And they tagged UHAS students as the Montessori students because we were always ready to learn. We followed instructions and we were ready to, when we don't know, oh please, how is this thing done? And they were really happy. Even if you are not in your lab coat or your name tag and they meet you and which school are you from? You say UHAS, they'll be like, hey, wow, hey, that kind of thing was there. So I really, really appreciate our dean, everybody who is making the UHAS name out there. So that when we go, we are also enjoying that grace and that the name UHAS. And some of the recommendations I will make is, although the VT monitoring team has been coming, but sometimes they'll call you in the morning that we are on our way. I know it's not their fault, but when they give us time like, oh, maybe you'll be here around 8 o'clock to 9 o'clock, and something comes up and they can't come, they should tell us, because sometimes you ask permission from your in charge that, oh, we've gotten a call that our monitoring teams are coming. But when you go out there and you call them, they'll say, oh, maybe we are late or this thing. But you already asked them for permission to come and meet them, and you've been given that. So when you go back and you tell them, they'll be like, maybe it's because you didn't want to work or something. So if there's something that would delay them, they should please let us know so that you know how to schedule with our in charges. When they come, then you will meet them. And I want to thank them so much for the opportunity of monitoring us, because when we went to the ward, we had Legon students, KNUST students, Wisconsin students, and none of them had the privilege of them being monitored. But we had the privilege with our lecturers, our important personalities in the school coming to monitor our activities and asking of our challenges. And one thing I must say is when they ask of the challenge, it's not like they'll just write it down and forget about it. No, they work towards it to see that you are comfortable doing your VT, so that at the end of the day, you wouldn't be found wanting. So these are experiences for the VT that was done in 2021 and 2023 for the sandwich nursing students. Thank you very much.
Hello. Thank you, Mary Ampado and her team. We can see that Mary and her team, they are one of the favorites. Okay. So we go on to the next team for the presentation. That's Laboratory 100 Nursing. We call in Daniel Mensah and his team to give us the presentation.
Please, good morning, Vice Chancellor, Dean of Students, Dean of International Students, Director of Public Health, Faculty of Staff, all protocol observed, and the entire Sandwich student body. I am Kofi and I'm here to present on behalf of nursing level 300. We shall start ours with a case that we experienced at the ward. We did our clinicals at Rara Government Hospital, and then the year it's established in the nurse manager with the name Mr. Dakon Yao Ubed. So in our case, the patient was referred from Dambai Health Center, and on account of heart failure, but sick of financial constraint, the client had to spend 2 days at home before she was able to follow up with the referral. She was a 47-year-old woman, married with 5 children, and then a farmer and a Christian. So these were her history, her medical history, a known HPT, but a defaulter. And she was using alcohol as well. So these were her clinical manifestations. And it was quite severe, especially with the dyspnea. So we did the following labs, and we came up with this diagnosis, like congestive heart failure. So this is where we performed. This was a case that was handed over to me because they wanted me to monitor and then try my experience on the nursing diagnosis and then the nursing assessment. So I did the following assessment, and I got to realize that anytime the SpO2 level was very low as 42. So if we wean the client off the oxygen, that means the client is going off like that. So she had to be on oxygen 24/7. It was a very severe case, and I came up with this following nursing diagnosis. We followed up with the admission processes that we received a client from the emergency. She was in the wheelchair, accompanied by a relative and then a nurse. We welcomed her and then established reports, history taking, and routines, explaining an orientation done at the ward. So upon the assessment, we got to realize that it was a heart condition, and then made a cardiac bed for her, and then they requested samples taken to the lab. So the client, as I said earlier, the client was strictly on the oxygen, whilst we were giving her the following medications as well, and then restricting her on sodium diet, low sodium diet, and then restricting fluids as well, and then enough bed rest for her. But unfortunately, as the days went on, the client's condition was deteriorating. And then on the 6th day of admission, I came to the ward in the morning. It was a Sunday, and realized the client has gone. It was very sad, but then I took solace in what Virginia Henderson said in the definition of nursing, that yes, we are to assist the individual, sick or well, in the performance of those duties contributing to health and its recovery or peaceful death. So to me, I took solace in the fact that although we lost the client, but I believed she died very peacefully. So that was the solace I took from the whole situation. Please, we will go on with our experiences, and then I will let my rep handle that part. Thank you very much.
Okay. Thank you very much, Kofi. So our experiences so far with the VT, one, we say rational. We are able to decide about our cases. We are able to explain our procedure thoroughly to our clients. before they are carried out. Our professionalism has also improved through this VT that we've been embarking on. Our time management also have been improved. The time of going to work, which our preceptors can also testify to it. The time management doesn't only isn't about coming to work. Even in medication giving, there's a medication which you have to be given at a particular time frame. With this time management, we are able to take our time and administer our medications as well. Our critical thinking has also been improved. Our communication with our patient and healthcare team has also been improved as well. Through this communication, we are able to find out what is really wrong with our clients when they always visit us at our various facilities. But application of theoretical knowledge in our clinical settings has also improved, especially those whom always found themselves at a cheap compound. In return from the VT, they are able to handle their facilities well as compared to when they were not doing the VT. Our teamwork has also improved. We are able to work with other colleagues from other facilities, which we've also gained knowledge through that. Our challenges, accommodation and rent issues. Since most of our colleagues find themselves in the cheap compound, they are to get a facility which are mostly far from where they work. In these cases, they are supposed to rent, which also burdens them. Transportation first, especially moving from where they stay to the workplace. Delay in delivery of our VT letters, which was a very big issue in our last model. Some colleagues were supposed to even stay behind to the following day before they were able to get their VT letters. I think if the authorities can maybe work with the course reps, maybe we can find a very good solution to that, so that when we write our exam, our last paper, that won't be the very day that we are supposed to get our VT letters. And also unannounced supervision by our VT monitoring team. Sometimes you might be off duty, and when you are off duty, somebody might travel, somebody also stays far. So when they come unannounced, and you're supposed to come to the facility so that you will sign, it's also posed as a challenge, because somebody might have even traveled, and the monitoring team might think that maybe you are not at work or you don't even come to work. So when maybe they come unannounced, I suggest they can talk with the in charges and really know whether the colleague or the person is really coming to work or not. So far, these are our story and our challenges and experiences so far in the VT. Thank you.
Thank you, Daniel Mensah and his team. We continue with level 300 midwifery, and we call Ferdinand Asiri and her team.
All right. Thank you very much for the opportunity given to do presentation on behalf of PHN class level 300. My colleagues have already addressed the dignitaries and then the house, so I'll just go straight forward to our presentation. Okay. Yes, as the name suggests, my name is Ferdinand Ansreni Fawo, a PhD student. We are just going straight forward. Our presentation outline, we are going to look at the introduction of this presentation, experience during our vocational training, interesting stories during our vocational training, then challenges that we face during the vocational training, then some way forwards that we suggest to the school if they could help address some. We have some gallery that we experience at a training. We will do acknowledge the school team for their wonderful work. Now, on our introduction, as the previous presenters have already explained the meaning of vocational training, it is similar to that of ours. And it's a form of education that seeks to train people like us, the nurses, pharmacists, and then lab technicians and other health workers to gain knowledge on it. It also refers to institutional programs that focus on the skills required for a particular job function, in this case, called the nursing practice. It also helps health workers to achieve work-life balance, job satisfactory, and that of feeling of meaning. It leads to new opportunities as we meet new people at the working environment, discovered new skills as we learn from them. Then some hobbies too have also been done there, and the experience that we share or we get from the field. Now, let's walk through some experiences that we had from the field. One, some of us, or most of us who were on the field for the vocational training, assist in various surgical procedures, both minor and that of major surgeries. It interests us because we, the public health nurses, you all know that most of us are community of nurses and we have to join this program. So we don't actually do some of the clinical aspect of the things. So when the university gives us the opportunity, it interests us to put these experiences here. Some other faculties or some other classes will see it to be, maybe it's not new, but it's new to us and due for us to share it. We also learn and practice some sterile techniques and infection control measures in the operating theater or operation room. We assist in the administration of anesthesia and then that of monitoring patient vital signs during surgery. It was a wonderful seeing some of us observing it. Then learning and practicing proper surgical wound care, and that includes changing dressing and wound assessment. Most of us at the various facilities before we got to this university, we were not like, it's minor wounds that we were taking care at our, but this have given us an opportunity to meet a bigger hospital where you see some infectious wounds and you have to take care of them. Now, still on experience, we gained some experience in post-operation monitoring, including assessing the patient recovering, managing potential complication, and that of recognizing what? Signs of surgical site infection. We also collaborate with the healthcare team, including the surgeons, the nurses, the anesthetists, and that of the hospital administration to provide comprehensive and coordinated care to the patients that were in our care. Last of our experience, we are saying that we also learn and utilize some surgical instrument, equipment, and that of the technologies that was used in the theater. Some of the instruments in the theater, we don't even know them, but VT have given us the opportunity to learn some of them. With the aspect of reproductive health and reproductive and child health, it was wonderful as it is our usual job description. So that one, it was something that we explore most and we enjoy it, and it was also good for us. Participating in patient pre-operative assessment,
was also one of the activity or one of the things that we experienced during our clinical session, and that of conducting physical examination and performing other necessary tests before surgery. Now, some interesting stories. It baffled us when we meet some of our seniors who became in charges at the various facilities, wards, and the hospital, and some too who are not even seniors from this school. They have to gather some of us and take us through some procedures, teach us like the way the lecturers do to us at our various classes. It was very interesting to us. We have not been seeing some from our college. Some even there was different at the ward. When you see us with the college students who are doing the same clinical at the ward and the relation we have with the in charges and those seniors at the ward, it was superb. One other interesting story was that we experienced a case in the RCH unit where a client, that is a woman who came for family planning service, to our best of knowledge, upon interrogation, the woman did not inform the husband that she was coming for family planning service. Somebody informed the husband traced to the hospital to check. And he realized that he was in the family planning unit. The husband quickly brought up some 2 other gentlemen, including he himself, that they were coming to be the nurses in the RCH unit. So we realized it. And the way they walked in with their tenses and things, we just calmed them down. And after educating them, counseling them, they marveled us. 2 of them just got up, picked their motorbikes. The time we realized 2 women was with us to offer family planning service to them. And it was so interesting. So it deemed us necessary to share it. Health education, counseling is very important. You meet clients in the ward, the way you talk to them made them heal, made them recover from their sickness. Some people come with anger, they say this hospital, this is how they are. But when they got to the hospital, they have different stories to go home and tell. And that is what we have to share this story. Now, upon the experiences and those interesting stories, we have some challenges too, and we need to share them. One of the challenges we encountered or we have was that it was assumed by the hospital staffs, students have already had the experience of surgical procedures before they are getting to the hospital. So some other staffs in the hospital feel reluctant and they think that you already know. So they don't want to come forward to teach us certain things. So we as students have to prune them and just let them know that we are ninos to some of the items. Some hospitals demanded for surgical and examination gloves from students before they could start the VT. Yes, even though before we could leave for the VT, they told us that carry surgical gloves in case of anything we were having. But it was too rampant. Why we bring this point is that the school have given us the go-ahead, but it was so demanding from the hospital that after giving them those things, they are still demanding from you. So it was something that we didn't like, and we said we have to share it. There wasn't enough time to prepare before and after the VT. We understand that sandwich is something stressful, but with the VT and then the stressful way of doing the course, we have to have some enough time to prepare. The VT letters were not distributed on time and appropriately. I didn't mean to say this because there was pressure on the university staffs to give us the VT letters, and we students too were stressed out. Some students after our last paper, we want to go home, and the letters are at the office. You see us queuing, pushing each other, and those kind of things. So we have to look at the way of sharing the VT letters, maybe coming the next time. Lack of knowledge in some surgical and medical terms, which was supposed to be done in class, as I said earlier on. Some other people assume that we have already done that. And you know, PHN class, as I said earlier on, we are community of nurses, and I wish maybe some surgical procedures, if they could show us or give us the guidelines before we get to the ward. It will help us learn more. Due to the nature of our roads and communities, some VT supervisors, I really pity this point and the staffs that come around. It wasn't easy for them, and I think Revenant have mentioned it earlier on with other people. It wasn't easy. Some of us, they have to get to us in the night. After coming to supervise you, you wonder how these lecturers are going back. So it was too serious, and then we have to also find a way. Even though the university have been one of the best universities to go around and do supervision, because in the ward or in some of the hospital, the other universities and the ward people, they become surprised to see UHAS, wherever you are, they will come. If you are even in a hole, but they will come. We are also saying that there is lack of home visiting bags for the aspect of PHN class or PHN students. Yes, we are pleading if there could be something done on that. Due to lack of steady leave, some students have to travel from far to their VT centers, which costs them a lot at the end of the day. There was not enough time to prepare before. I think I've mentioned this point earlier. Inadequate space and other basic equipment at the skill lab for practical. And I think the school already noticed that, and we are mentioning it here today. The skill labs we have here, in fact, the space per our population is too small for us, and it can't accommodate all of us going forward. Now, way forward to these challenges. We are saying that, students embarking on vocational training would appreciate if the school could introduce them to the objectives for the VT before asking us to go for the VT. And this will help us make an informed choices to the various hospitals. We are again saying that we will appreciate if the school could allow us to go through the theoretical aspect of surgical nursing specifically and others before moving to the various hospitals for practical. We do suggest that if the school could relate with the various hospital clinical coordinators to coordinate the movement of we, the students, in the various hospitals. Now, way forward number 2. We are also saying that per the home visiting bags that we mentioned as a challenge, we are pleading with the school to equip at least 10 to 20 home visiting bags for the PHN practicals purpose. We still plead with the school to relook at the space in the skill labs as we suggest, and if possible, if they can equip some other basic equipment for us. Now, on the gallery, this was the supervision or monitoring at Tamale that some of our VT coordinators came around. Another supervision at Ashanti region, and you could see the VT people. Yes, interest us to share pictures like this, and it will be something else to other people. You see, it's usual, this particular thing is usual to the clinicians. Almost all the time they find themselves in the theater, but we don't get that opportunity. So VT have given us the opportunity to observe these things. And you can see some of my colleagues just doing similar. Now, observation of another surgical procedure in the theater. While some of the theater nurses were trying to teach some of my colleagues, the RCH unit was not left out. Some of my colleague staff have to do this. Yes. On this note, I do acknowledge the Vice Chancellor and her team, the teaching and the teaching and non-teaching staff, for the support, guidance, and that of the impact of knowledge to us, irrespective of all the challenges we face on campus. God bless us all. Akwe Kaka. Thank you very much.
Hello. Okay. Thank you, Ferdinand and his team. We call in the last group to do the presentation. That's midwifery level 300. Regina Tete and her team.
Who's going to do the presentation? You. So you use the arrow, this one, to go to the next. Okay. This one.
Hello, good morning. Please, we are midwifery level 300, and this is our presentation. Introduction. The VT practical course is designed to help students, nurse, midwife. Okay, sorry. The VT practical course is designed to help students, nurse, midwife in advanced nursing and midwifery procedures. The course is also designed to equip students with practical skills during their VT placements. The VT program for sandwich midwifery students who started at level 100 was in the year 2021, and it was about basic nursing, which lasted for 16 weeks. The second VT duration was 8 weeks, 4 weeks for medical and surgical nursing and 4 weeks for obstetric nursing. The second VT was based on medical, surgical, and midwifery practice. Our objectives of the first clinical vocational training. Students should be able to perform basic nursing procedures. Students should be able to demonstrate principles of asepsis. Students should be able to apply the nursing procedure in caring for patients or clients. Apply principle of homeostasis to care for the individual sick or well. And also apply basic principle underlining health and diseases to give effective nursing care. Student objectives in VT2. Students should be able to prepare patients for surgical procedures, assist the theater team in surgical procedures. Students should take up the ward as a charge nurse. Students should be able to take labor, pass obstetric history, and also admit a woman in labor, care for and intrapartum clients, and health education during antenatal care. Please, our competencies. Preparing patients for surgeries. Treat theater techniques such as scrubbing, gowning, and other aseptic techniques. Receive, position, prepare skin, and drape for operation. Prepare patients for intravenous pyelogram, intravenous. Antenatal history taking, health education during antenatal care, health examination of the antenatal clinic, and take labor history as well as admit a woman in labor. The competence continues. Perform and teach clients breast self-examination, resuscitation of neonates, induction of labor, abdominal palpation, booking of clients for ANC visits, and educating pregnant women on personal and environmental hygiene. Okay. Please, our achievement and accomplishment. Vocational training is meant to equip sandwich students with the needed skills in these various fields. And indeed, we must confess, we have been equipped. As a midwifery student, the VT has given the opportunity to improve our knowledge on medical, surgical, and obstetric nursing, especially to those of us who are a community of nurses. It has broadened our knowledge a little bit on medical, surgical, and obstetric. VT has given us the exposure to be a par with the current trends in midwifery, and it's true. The VT program has given us the opportunity to learn and sharpen our skills in labor and ANC. The VT program has given the opportunity to try our hands on things that were taught in class, and especially on the things concerning surgical and medical. Please, our experiences. The in-charges at the hospital are always ready to teach students and help students to gain more knowledge and understanding on procedures and conditions of patients. They normally supervise to do a task, yes. As a student, you will never be, left alone to do a procedure on yourself. They will definitely help you. Students are given a topic to do research and to present on it. And this is solely true. I had an opportunity to be given a client to study everything about the client, and at the close of the day, my in-charge will call me, come here, what was your findings? And she would digest my findings with me, teaching me what was right and what was not. Challenges.
Please, the experiences. I would like to share my experiences. During the second VT, when we were in level 200, the afternoon staff who have to come and receive the baby at the theater was not available then. So I was asked by the in-charge to go and receive the baby at theater. When I got there, I realized that the baby was asphyxiated. So I have to resuscitate the baby. I have to use all the techniques that Dr. Bless taught us. In fact, I did it well to the extent that when I was giving my findings, the anesthetist then asked me, this girl is from UHAS. I said, yes. He said, come and take 200 cedis. He gave me 200 cedis, and he also bought me food that day. Then he asked me that the work that he was supposed to do, because during that time, the baby was really asphyxiated. So the anesthetist have to come in and play a role. But I did it without his supervision. I did her and I gave him the ABGAS score, and he said, wow, this girl have done well. I used the ABGAS score to, assess the child before we transfer the mother and the baby to the ward. Another experience was I observed induction of labor at the ward. And then the in-charge asked me that, Reggie, the next induction, you will do it. She didn't ask me, Reggie, can you do it? I said, yes, I'll do it. I followed her, and then she gave me a client. I started doing the induction. She asked me, do you know the indication for induction? I said, yes. Post date. And she said, from where? I said, from 42 weeks. She said, what are the methods? I mentioned, you can use the oxytocin, you can use the misoprostol, you can use the artificial rupture of memory. And she was like, wow, this girl, you ask people, when you are in the ward with us, we are proud of you. So through you ask, when after the VT, I returned to our various facilities. There, my in-charge was a midwife. So she started asking me, when you went to the VT, what did you learn? Then I said, oh, I was able to do serious resuscitation for a baby, and then also do induction. Since then, they have added me to the midwifery team in our hospital. So through VT, it has given me the opportunity to become a midwife at my facility.
Thank you, my sister. Please, our challenges is as follows. The collection of VT letters can be so stressful on the students. Sometimes the letters comes with errors of student names, level of student and facility names. This can be corrected if the letters are made available before vacation day. At the various VT hospitals, some monies and items like gloves, cotton, tissue, hand sanitizers are being collected from the students. The monies being collected from the students should be paid by the school and not the students. The mental health affiliation students should be able to choose any psychiatric hospital of his or her choice and should be provided with nice accommodation by the school. Yes, we deserve that.
Yes, for mental health, what I realized is that students are supposed to spend 4 weeks, but because of the situation that is there, students are not able to complete the 4 weeks. I learned the place is not conducive for them, the washrooms and other things, and that makes students to do only 2 weeks and run away. So I think before we go and do VT, our supervisors and the rest should follow up and go to the various hospitals and see whether like the place is well accommodated. So this is our humble plea.
Thank you. Some hospitals do not have receptors to assist students to learn on the field. Then our recommendations. Buses should be available to commute Sandwich students from various vantage points to their located hospital. Money should be paid to various facilities before the student gets to their various facilities. VT letters should be sent to students via emails to avoid stressing the students and staff. The staff that are responsible for typing the printing of VT letters should accord Stanridge students with the needed respect. The first 16 weeks VT should include our various specialities. Thank you.
Yeah, please, for our last point, what I realized that our first clinicals during level 100, we spent 16 weeks, and when we went, none of our specialty was allocated for us. We went there, and then we have to spend 4 weeks at a medical ward, 4 weeks at, and the in charges were asking us, are you not a midwife? Why are you spending so much time at the medical side? So we plead that the first clinicals, even though we normally do basic things, we plead that they should access to go to our various specialties, at least if A and C, so that you can observe how to carry out examinations on the pregnant women, how to, weigh the baby, examine the abdomen. Because spending all the 16 weeks at the medical side, I think it doesn't do good to the midwife. So please, we beg. Consider it.
Yes. Thank you so much. Sorry, our end of presentation.
Okay.
Thank you very much, Regina Tete and her team. We now call in the HOD for Public Health Nursing to give her her speech. Dr. Dati.
Good morning, everyone. Congratulations to all the presenters. You did very well. And we pray that you continue to achieve higher heights in all that you do. It's so surprising that our students are saying they have achieved a lot of things and that they are personally composed, yet we see a lot of them at the back talking when their friends are presenting. It looks as if people came in only to talk without listening, and that is not good enough. When your colleague is on the floor, you make sure you accord that person the respect. You are asking for respect from our staffs, but you have refused to respect yourselves, and that is not what we are expecting from you. I think that for us, we are happy that you are happy, maybe halfway, and still need improvement.
I want to touch on some few things that I heard here. The clinical hours should be reduced. I want to acknowledge that nursing is a standard internationally. If we reduce your hours, we'll put the less hours in your transcript, which internationally you are not qualified to practice. These things are not done because somebody got up and put the hours there. We calculate the hours according to international standards, meet the standards. You should not do less than 1,000 hours practicals. And I don't think we are giving you that 1,000. So if you want a further reduction, I don't know how we are going to change the transcript, because all these hours have been calculated. And even before those who are writing the licensing, we have to calculate the number of hours for medical, surgical, basic nursing, all the courses you do. We enter it. Maybe your class reps, the seniors, you can inquire and find out how we do these things. They are not for fun. They must be on your transcript. Otherwise, you are not qualified, or you have been undertrained. So that is the first point I want to talk about. The home visiting bags. We only have 2. And when we send the home visiting bags, it comes half empty all the time. And we have to refill them. In any case, we are planning to buy more, but we also don't have the spaces and people to be responsible for them. So if we agree together that we will take responsibility of the home visiting bags, we will provide them. The space per your population. You know now. You know what is happening. The space is limited. But I think the next 6 months, those who are coming back will have enough space. By then, our China phase 2 would have been ready. And so all the space issues will be resolved. We can have our own skills lab as a PHN, and then anything you want to do there, we can get these done. For surgical and medical nursing practical experience, I think it's the basic. I don't know whether we have to add it to the basic nursing or the advanced. Okay, the person said advanced nursing. In actual fact, it's only the public health nurses who even do basic nursing. The general nurses don't do. But we have taken note of the practical hours that needs to be added. And then the advanced nursing will also be added. I think that for the curriculum, for PHN, for instance, the new one, you are going to do the same with the regular students. So everything is going to be the same. So the advanced nursing is well represented there. What I want you to understand is that the hours you are complaining of, we still need you to do a little more hours and a little more effort on your own. If you know there is an area you are not familiar with, you can walk to the hospital. Maybe you want to give injections. You can go and see an in charge and say, in charge, I'm only coming for injection. you time 2 hours by 2. You know when they give injection. So the area you are not competent with, go and see an in charge. Tell the in charge, this is the only thing I'm coming to do. Spend the 1 hour, come back. One Saturday, one Sunday. There's nothing wrong. You are only building yourself. In actual fact, your confidence level is always high when you are skillful. So when Joseph was complaining that they don't know anything about surgical, whatever, and that anyone in white, in actual fact, if you are in white, you are a big person. So you don't expect those in green to be doing the work whilst you are sitting down. That is why you find extra time to learn those things that you are not conversant with. We can all be in the same class, but what you pick is different from what I pick. So let's make extra effort. It is for your own good. The competition is high now everywhere in the world, including this country. So what is the difference between yourself and the other person who is competing for the same job? It's your skills. And I've always said that the book long doesn't help in nursing. The book long, I always come, whenever I meet you, I say it. Book long doesn't work. You are not going to read, giving IV, okay, clean. Then you come. Oh, what do I do? No. You must get it off your fingertips. And this is the only tool we need. And wherever you go, it goes with you. It paves the way for you. It opens doors for you. It is your skills. I wish you all the very best in going forward. Those who are leaving after December, all the best. Those who are coming to see us again next year, we wish you all the best. Thank you very much.
Thank you, Dr. Dati. Please, we call in Dr. Ellen Cruce.
Thank you. Let me add my voice to my senior HOD to commend all the persons who have presented. In fact, you have done very well, and I have picked a few things from the presentations that you have made. One is that the goal of it is being achieved. The goal of it is to ensure that the theoretical learning that you have acquired or you have is yielding results. And from the presentations, I see that a lot of learning has occurred, and that is very, very encouraging. The cases that were mentioned too, I've also learned a few things from that one. What I want to say in relation to this is that those who said they want the theory before the practicals, that is good. It is important that you have an appreciable amount of theory before the practicals come. It paves way. You are able to follow what is being done. But we should also know that some of the cases that you see, like the one our friend presented, that they return all the viscous or the abdominal organs into the abdomen, and then it didn't go well with the patient. You may never see this again. So if you want to learn all the theory before you go for the practicals, you'll be lagging behind. So what we need is an appreciable amount of the theory or volume of the theory that makes you follow what is happening. And so when you go and it happens like that, the best thing to do is follow those who are the experts and they are teaching you. And then you yourself to do some research. I was telling a class the last time that the curriculum is quite voluminous and the time is short. So you cannot do everything. And in fact, you bear with me, but by the time you complete, okay, some of the things might have become a cake. The last time we received a letter from NMC, the indication is that pathograph will have to be improved to another level. So what we are also doing here is that, especially throughout, to look for new information to be abreast with time. And so all that I'm trying to say here is that the learning that you will do, a lot of things has been factored into it, the structuring and the rest. So if you don't find it very beneficial because some things come ahead of others, just know that it will not be smooth all along. There are some times that you have to put the cart before the horse. Okay. Then another thing I also gathered is about collaboration. Okay, there's a course that is being introduced in other sectors, is that, you know, in a health work environment, it's a team. We have to learn to live with one another. And this thing is, sometimes it doesn't go well. Some, I mean, cadre of professionals see themselves higher than others. Some also see themselves as below others. And so that flow of teamwork or team spirit is not at its height. Okay, so I'm glad that some went to some places and things are going on well. But the others, let's learn it that no matter what the situation is, one cadre of professional will not be able to take holistic care of the patient. And so let's learn to live with one another. Now, the challenges, the delay in releasing the letters. In fact, we have seen that, and I want us to clap for our dean. He has called us on that, and he's trying to solicit that we should find a way of resolving that. So it's not as if we are oblivious of it. We are working towards it. Then the other one is about the unannounced monitoring. This one, we can't promise you that we'll always tell you, because some people are doing very well. For me, for instance, when I go to the facility, whether the student is there or not, I have a way of checking. You see, I go to the various wards that the student is supposed to have gone, and then we go through the time books. This is to tell us, when you go and time books are not in the ward, buy an exercise book and start writing, because that is an only indication that you have been there. Okay, so when we go to the wards that they say they have put you, we go to the various wards. We check the attendance. So if you are off duty or you are on duty, the attendance is there to show that you have been there. And even the time schedules. Okay, some in charges bring them out. And then we look at it, we talk to the in charges and the people you run shift with. Do they know you? You'll be surprised that some people, they have made a time for them and all that, but they have never been there. So the people they are supposed to run shift with, who are the team members, do not know them. You see that? So when we announce that we are coming, it means that those people will just come and do some few days, bribe some people, and then, no. The VT is very important to us. Those I've met, I keep telling you that when you come out, you are a nursing officer. Officer position is not a joke, because you'll be in managerial positions, you'll be playing managerial roles. So we want you to let the flag of UHAS fly high. So we want you to, some people is because we do the unannounced. That is why they even go to the facilities. Okay, so to say that we'll be informing you about all the monitoring that we'll be doing, that one I can't promise you, or we can't promise you that. But at least before we come to the facilities, you have a call. So the unannounced visits or the unannounced preparations that you have to do is important for us, because we know that if we should announce it way ahead of time, people will pay their way through, and that is not what we want. Then the financial challenges. Somebody said they want the university to pay the fees that they are asking the students to pay. See, the university has a memorandum of understanding with the facilities that they send you to. So in that MOU, it is stated that our students will be coming, and everything else that is needed, I mean, is discussed at the level of our managers before the students go. So those students who face those challenges, I'm not talking about gloves and the rest, because that one they told us, some logistics the students must bring. And so the gloves and the rest, I mean, that one they told us. But where you are asked to pay, we would like to have a tete-a-tete with those students to find out what exactly happened before we follow up on them. And another side is that we know that things are very expensive these days. It will interest you to know that the cost involved in VT, if all of it are to be put on students, it will be difficult to pay. Because for a pickup to travel all the way to all the areas that we meet you is very, very expensive. So to say that buses to convey you again, then it means that you has to be highly indebted. So we plead with you to bear with us so that we share the cost and bear, because at the end of the day, you are also coming up with a certificate that places you at a very envious position. Then about the hostels in the places that you go for affiliation, UHAS does not have complete oversight over such places. In fact, every health facility in the country is supposed to train the workers that work in those facilities. So as part of their contribution, they are supposed to train the trainees who are supposed to come up as a qualified staff and work in those institutions. So we have heard about the deplorable states that you complained about. Whilst I say that UHAS does not have direct hand in repairing or furnishing such places, I think if we liaise with our management, they can talk to them so that they can work on it for us. Those are the things that I have picked. Thank you so much for letting us learn. I will also let those who are coming after me to address anything that is left untouched. Thank you very much.
Thank you very much, Dr. Ellen. We now call in Dr. Cook to continue the answers to the various questions.
Hello. Before I say anything, I want to take the opportunity to apologize for the HOD Nelson is not here, so he says I should apologize on his behalf. He's engaged somewhere in an equally important event. Before I say what I want to say, somebody mentioned an experience about Stephen Johnson's syndrome. Do any of you know what it is? You know? Yes. So let me tell you my own experience. When I was a student, during our undergrad days, we were sent to we were supposed to be doing our clinicals at Reach. Then that was the first time I saw somebody with such a condition. And you know what? It is basically a reaction to medication. Yes. So this particular person is a housemate, right, who was forced to take medication for malaria treatment. And you know, before we transited from the use of chloroquine to yes, we used to use SP. People prescribe SP. Yes. So the sulfur was what the lady was reacting to, sulfur-containing medication. So she took the medication and wasn't getting well. Then the madam didn't understand why she's not working and say she's not getting well. So they gave her more doses of the medication. So before they realized the lady had reacted so badly to the extent that the whole skin everywhere, the mucous membrane everywhere peeled off. So she passed because of, you know, at that stage, it is very difficult for you to survive. So she passed. And that was the story. The madam didn't allow her, kept pushing more dose of the sulfur-containing medication, and she finally passed. That was the very first time. So sometimes when you read and then hear the conditions in the classroom, the VT affords you the opportunity to see some of these conditions and then follow through the course of treatment. Now, let me go to the monitoring team. Sometimes one of the challenge or one of the complaints is that we should give you time, so that if we say we are coming at 5 or we'll be at your facility at 10 a.m., we should be there so that you don't waste the whole day. Yes, you are very right. You are very right. But the challenge about the movement is that sometimes you may calculate that we are going to spend only 45 minutes or 1 hour in this facility. So in the next hour or two, we will be at your facility. We get to where we are going to only to realize that we have to stay more. Maybe the medical director says, I want to speak with you people, but I have a case in theater, so can you kindly wait for me? In that case, our time and schedules get distorted. So it is not our fault that we keep you sometimes the whole day. There was a time that we took off with our car from a facility, announced that we'll be there in 45 minutes, and when we took off, the car broke down. So some of those challenges come our way. So that is why we are unable to meet the time schedules. So what I will say is that for the period that we monitor, you have to make it. If we don't pay, it's not surprise visits per se. When the monitoring starts, you all know that monitoring has started. What you don't know is when we are coming to your facility. But normally, we put you on our page, all of you with your contacts. So we keep announcing. Maybe the northern team will start from Pandai, Saboba, and then in that order. So wherever, when we start, the whole team, those who are within the catchment area around the northern sector, know that the team has started moving. The only thing you don't know is when we are coming to your facility. And like Dr. Kluche said, sometimes the announced visits are very key. We hear and see a lot of things. It is not deliberate, but if we happen to come and you are not there, and it happens that you have been going for your clinical attachment, you are very punctual, you don't have any issue, the administrators won't say anything until bad about you. They will give us good report. So the only thing is that you won't be able to meet us, but we will get the good information and then the good work that you are doing. So for the unannounced visits, sometimes we can't avoid them. There was this time that we went on monitoring. Northern region, Tamale. I went with one of the senior members of this university, the then dean for School of Public Health. It was Prof who called the student himself. Where are you? So we are at somewhere at the X-ray imaging unit and some the diet unit. They are not nursing students anyway, but some were also, nursing students were also part. So when Prof called, they said, oh, we were at the facility. Then Prof said, okay, we'll be visiting you today. As at the time that we'll be there, we can't tell, but just try as much as possible to meet us, because we will leave Tamale either late in the evening or the next morning, so we wouldn't come back to Tamale. So we want to meet you before we leave. The students waited. And when it was around 1, the time Prof gave them, and they didn't see us, they went home. We got there and Prof called again. Where are you? The student just said, we are gone. Then Prof said, gone to where? He said, home. Then Prof said, come back. He said, we can't come back. They said they can't come back. And you see, it was quite rude. Even if you can't come back for reasons known to yourself, that's not how to put it. So, out of, unfortunately for them, we didn't leave Tamale that night because we decided to stay. So we stayed back, and then Prof said, we have to go and see those same students. So we called them in the morning again. Then the gentleman said, I hope this time you I hope this time you will be here early. So when we got there, he came. Then after we introduced ourselves, then he now started shivering. He told Prof, oh, sir, I'm sorry. And Prof said, you don't need to know me the way you were talking. If your supervisors are coming to see you, and for one reason or the other, you can't be there, is that how to speak? Sometimes it's sacrifice, okay? Whilst we keep you, we know how inconveniencing it is. But you should know that somebody is traveling from Volta region across Dambai, yes, moving around to come and see you. And you cannot sacrifice just an hour or two to wait for them. Sometimes I don't understand. But I know you don't understand why I don't understand. Because I don't understand. I don't get it. Just the 1 hour, 2 hours, you don't have that to sacrifice. But you've forgotten that somebody has spent sleepless nights traveling throughout the night, okay, to come and see you. So what I want to say is that let us also be a bit considerate. Sometimes if you are coming and then we give you time and we don't come, you should know that it is not deliberate, but it is because of the activity. Sometimes you want to leave and you meet your classmate. They say, oh, no, you push, you come. I didn't know you were around. In that, you cannot brush all that off. So when we are moving, some of these things come up. The VT letters. Before I say anything, I will say that with Reverend on the seat now, you are not going to get any delays for the VT. We will start preparing for your letters right after this forum. So by the time you are going to leave, you will have your VT letters. But let me be quick to add something. You know, the delay doesn't just come from faculty or administrators. Some of you are more than chameleons. Excuse me, you are more than chameleons. I will go to facility A. Then we say, okay, facility A it is. You turn around. I don't want facility A again. I hear that, so it means you didn't do due diligence. You were just going there. You heard that place, there's no accommodation, so I want to change. There are some of you who will agree with me that you attempted changing more than 4 different times. How do you expect somebody to be changing your posting letters? The administrators are human beings. So also consider. So please, before you get your letters and go, as we all want it, what I want you to do is that know exactly where you want to go. Know exactly what, and be very decisive. Don't let us give letters, then you turn around and say change. Sometimes Matthias and then his colleagues, they get so frustrated. Even as late as 10 in the evening, they are still changing letters, VT letters. And let me tell you what happened last time. In fact, pay attention. Last time, they gave you the opportunity to choose your levels. And whilst putting your name, you were supposed to click on a drop-down button to choose whether you were a level 100 student, 200, 300. Some of you ignored that. You didn't. And the drop-down, if it is in 300 and you are not 300, you are not in 300, you didn't take the pain to check your correct level. How are the administrators supposed to know that you are not a level 100 student if they see 300 attached to your name? Because you didn't do due diligence. You didn't check. And you submitted. only for them to prepare your letters, and you turn around and say, I'm not in level 100. Why should you, what kind of posting letter is this? But you've forgotten that what you put in is what reflected in those letters. That was one of the challenge. And your names, spelling of your names, you were asked to fill those details. Your name and then the facility, your level. So if they give you an Excel file, the letters are prepared from that. Give you the proper information that we need. Then you put in something different. If you spell your name wrongly, they will not write it differently. They will give you the wrong name. If you, the drop-down button, if it is on level 100 and you are a 400 students and you don't apply, you don't check the right level, then you will be in 400 and then you have a level 100 attached to your letter. Anyway, thank God, when we implemented it, we saw the mistakes and then the challenges. So we are going to do something very different. And then you get your letters before you leave. This time round, you won't spend Christmas with us. Because, yes. And then the skills lab, the HODs have already mentioned that. Those of you who are going away, we are sorry, you can't be you can't enjoy what we are going to enjoy. The rest of us, we may have a very spacious place to practice. And for PHN, we've taken note of what you have said regarding your med-surg experience. It reflects, because when it comes to the professional exams, one of the key things that we have to address is about your med-surg. So we will look into it and then make sure we streamline things for you. It is just in fora like this, we use them to address the issues. I just thank you for bringing up some of the key things, some of which we are already aware, and then some that are just new to us. We will work hard to make sure we put everything in place for you so that we will all be comfortable. Once you are comfortable, then we are also very comfortable. I will leave you for now, and then maybe take questions if you have any. Thank you very much.
Thank you very much, Dr. Cook, for such an explanation. We now call in our Dean, Professor Datara, to continue.
Okay. Good afternoon once again. I think almost all your questions have been addressed by the HODs and the coordinator. There's one thing that I observed. The second presenters mentioned that students should be introduced to the objectives before they are sent for VT. I'm not too sure if you were listening to Dr. Cook. He made mention that now all your VT intra-semester learning objectives, they are in the VT manual. So if you don't have it, I would advise that, with the exception of level 400, the rest of you do well to get a copy for yourself. It will help you to prepare yourself ahead of the VT. And it comes with just, it's not expensive, just how much? 50. If you are ready to, if you can sacrifice one of your, either your lunch, you should be able to get one. And so don't leave UHAS without getting a copy for yourself. The second thing I observed when the various presenters made their was VT conference after the VT program. And I think that is exactly what we're doing. It is something we were doing it almost every year. If we are starting it today, we have realized the importance for this program. And so I can assure you that we will not stop. We will continue to have this, to listen to your concerns, to listen to your grievances, and then in attempt, we will address them. For the truth of the matter is that even though we are the first to introduce it, we have maintained standards since the year 2015. Others universities have introduced it, but from your stories, you can attest to the fact that they are not up to the standard. Is that not true? If that is true, can we, in fact, the staff of SONAM, clearly you are with us and you know, we are inadequate. We are very few. And we are still working hard to ensure that you get the best of nursing and midwifery training. And I want to thank faculty of SONAM and other supporting staff for making this a reality. All the stories you narrated here can only attest to the fact that we are doing well. I'm just wondering, Director of PA, how can we package this story so that others will read and know that we are not joking in UHAS? How can we put this out there for your colleagues who are yet to pursue their first degree to know that UHAS ultimately is the best? We are the best. We are determined to be the best, and we will always be the best. But let me not forget that if you are here, our access program, we have advertises. You have brothers, you have colleagues. Let them be aware that the forms are on sale. And I tell them they should not make a mistake. Are you listening to me? If you are happy being here, then don't be selfish. Encourage your colleagues who are yet to come. Let them know that UHAS is the best destination if you are looking for a degree program. Again, I think there was one of the issues you raised, and I think Dr. Klucher did that well. Asking for buses. I don't know whether at least you are aware of the challenges. That if you look at the buses in UHA, there are not many. We are new university. We are hoping that many of you, when you finish, now that you know what is good, give back. You can buy buses when you travel to the UK. When you travel to the USA, you travel to Canada, remember that SONAM UHAS, we need buses for vocational training. Till then, you need to bear with us that with the limited resources, we are able to do more than what we can ordinarily have done. So many of these challenges, as we move further, when our resource base improves, then we can assure you that many of those challenges will actually address them. And then, of course, the duration for the VT. I think the HOD for public health, Dr. Dati, explained. In actual fact, you need a minimum of 1,500 hours. It's not 1,000. Minimum. For you to be able to meet the required, your intra-semester clinical practicum is woefully inadequate to even meet 500 hours. So it is something we don't want you to finish. After you have acquired your degree, then we'll be struggling to register you for a professional exam. Remember, after getting UHAS degree, without a professional pin, in fact, you are not a nurse. So whilst we are mindful of the fact that you are overloaded, we are also careful that we don't punish you after you have completed. So bear with us. Of course, ordinarily we would have actually loved to see them do it for 1 month, 2 months. But for us to meet the required practical hours, you need to just sacrifice. Level 400, I'm sure you are happy that this is your last model. So nobody will follow you to go for VT. And once there is a beginning, there will surely be an end. So bear with us that we are working around the clock to ensure that you meet the academic standards and you equally meet the professional standard. I'm sure you've been hearing about the performance of your seniors. That this year we had the best nursing students, the best midwifery students, emerging as the overall best license in the licensure examination that was conducted 2022-2023. And we are talking about more than 10 universities, more than over 50 nursing training. Put together, UHAS came first in nursing. And I think we are not just making noise because we want to make noise. We have evidence, tangible evidence, to prove to the world that we mean business. Clearly, I wouldn't want to, I don't know whether I still have to come and give closing remarks, but I'm just combining the two. And so clearly, you should count yourself lucky that you are coming out from UHAS. I have had instances when we went around for VT monitoring. And when Dr. Cook was narrating his story, I think he forgot about one thing, that in attempt one of our supervision, we got lost. The name the student gave to us never existed in Ghana. But strangely enough, any name we mention, somebody knows the place, and there was no place. So we asked, we were going to this. They say, oh, continue. For us to move 30 minutes, 45, we will ask, oh, there's nothing like that. Just to let you know that it is actually not easy for the team of supervisors to move around the whole country. Some people mention sometimes one of the reasons why the students do not want us to take them by surprise. You know, some of them really do not do it. So anytime you say the monitoring team, they are coming, that is the time they want to play their cards to ensure that they either bribe their ward in charge, that when they come, tell them that we have been here. Some, it is one reason or the other. We have instances where even the hospital the student gave to us, we were there and they said there's no name like that. At that particular time, when we were calling the student, knowing very well that wanted to confirm, he put his phone off. Whilst you are quick to condemn, also hear that sometimes just because we are faculty, we are lecturers, we are staff, we really do not want to look as if we are not professional. But some of you, your character is not good. Like Reverend said, we understand that many of you, you are not here on steady leave with pay. So you are trying to meet up halfway. You run to the work, run here. We understand. But make yourself clear. Inform us so that we will know that this is the issue. Can you imagine Reverend lying? But Reverend had to make a holy lie in order to save somebody's career. And I pray God will understand. That is a serious issue. So let's, of course, you mentioned the issue of VT letters. I think Dr. Cook has actually addressed that. That can I tell you, we are also sometimes uncomfortable when you mount pressure on us. See, even the time they are asking them to come for the VT letter, they will not. After they have finished their last paper, all of them will match the date. Hey, we are looking for. Now that is the time when they see you. Hey, look at their faces. It's like Mountain Zion. But that is not. The truth of the matter is that we have very few administrative staff. And sometimes it is not only the VT letters. As you see them work, they do other things that also, but we are not saying that we will not prioritize. What we can assure you, we are going digital. Ghana is going digital. So who are we, UHAS, SONAM, to say that we will not go digital? We are doing everything possible that come the next VT, letters will not be issued late. And again, see, you're talking about respect. Sometimes you are complaining. 1 hour alone, you are waiting and complaining. Many of our few staff who do that, they spend the whole week, sleepless night. Sometimes they leave the office 11 p.m. and they are supposed to be there the following day. If you were in their shoe, sometimes, it's not all the times, you will behave like them. We are not trying to justify why they should behave so, but sometimes you need to exercise a little bit of patience. And if you do that, you will come to realize that they are lovely people. They are people who are really concerned about your welfare. So anytime that happens, if it has already happened, let me apologize on their behalf and to let you know it was not deliberate. And we will work to ensure that we minimize the idea of students complaining of disrespect. Ordinarily, they are not disrespectful people. Circumstances compel them to do so, and that will not be repeated. And lastly, my only prayer for you is that you learn hard, particularly level 400. This is your last model. This may be the last opportunity to be talking to you about VT. That is, if you will leave this university peacefully. Because if you don't pass your exam, we'll bring you back. You'll go and do VT again. So be sure that you work hard. Write your exam well. Make sure that you are not trying to do something evil. When you do that, know very well that you'll be caught. And we will want to always be proud of you. That you are living here with our degrees so that we can say that you learn to acquire it. Not that you came and copy and you have gotten a degree. We will never be proud. And if you are giving us this good story, it tells us that you are a very serious student and you will never indulge in such practices. Thank you and God bless you.
Thank you very much, Prof. No, yeah. It's time to do our presentation to the best students who perform well during the VT. So the first presentation will be done by our own Dean, Professor Datara. The first person and the one who did very well in the VT is Amponsa Kezia Akosua. Prof, thank you. Our second presentation will be done by Professor Elvis Tinkrai, the director of ITAM. Program, sorry. Please, the person is Bedu Susie Akosia. Is she there? Abidu Susie Akosia. Thank you, Director International Programs. Our third award will be presented by Director of PA, Mariam Gurin. And the student is Wuzui Mercy. Wuzui Mercy. So the last award goes to Kwashi Seraphine Esinam. Seraphine Kwashi Stephanie Esinam. Thank you very much, Director. Hello. Our Prof, our Dean has already given us the closing remarks. And we thank all of you for coming to participate. We are very proud of you for the attendance. We now call in our VT coordinator, Reverend Atiogbe, to give us the closing prayer. Reverend, please. You are needed.
Good afternoon one more time. They said I should give a last remark. I don't think I'll do that because Prof has done everything already. After Prof has spoken, nobody speaks again. So I'll just give the closing prayer and we are out of this place. So we can bow down our heads even as we pray. When we finish praying, I'd like to give a benediction as well. And that's from Scripture. Let us pray. Father, I want to thank you so much for the fellowship we've had with our students. Because your word says so, that's why we're saying thank you. And Daddy, I want to make a request from you, oh God, that everybody will finish school and do well. There are times that when we've heard they finish school, some have finished graduating, then the bad news comes that somebody has died or something. Daddy, we don't want that again in the name of Jesus. Father, we pray and we anoint everyone in the blood of Jesus. And let the blood that speaketh better things than the blood of Abel speak everyone here. Let it speak academic excellence in the name of Jesus. Thank you that as they travel in and out all the time, we pray for journey mercies. We'll not hear any bad news in the name of Jesus. You take them home back to their loved ones. You bring them back. In Jesus' name, we give you praise. We give you all the glory. In Jesus' mighty name. And now the benediction from Hebrews chapter 13, verse 20 and 21. May we receive the benediction now. Now the God of peace that brought again from the dead our Lord Jesus, that great shepherd of the sheep, through the blood of the everlasting covenant, make you perfect in every good work, to do his will, working in you that which is well-pleasing in his sight, through Jesus Christ, to whom be glory forever and ever. Amen. Powerful. We've closed. So you have to create some way over there for the dignitaries in front here to go, and then just do the honors for them. Wait for them to go, and then we can let them file out, and then we can follow. Right. They are coming coolly. Just wait coolly. So